14th of November 2024. Today we are talking about antibiotics, and this is something that we are very familiar with, but do you know about resistance? Because today's topic is about using it wisely and stopping resistance. And today, the guest in the studio is Anitha Ramadas, who's a pharmacist at the Kuala Lumpur General Hospital, and she's here to join us and to also educate us on exactly what is antibiotic resistance. Welcome to the studio, Anitha. How are you today?
Good morning, everyone. Good morning to you too. I'm doing good today. Glad to be here.
Nice to have you here. And of course, antibiotics, something that we all know from young. Right, so because we've been to the clinics and all that, so we hear antibiotics almost every day. But just for the layman, what exactly are antibiotics?
All right. Antibiotics is a type of medication that we use to treat infections which are caused by bacteria. So it has to be a bacterial origin of infection. Then only we can give antibiotics.
Yep.
If it's caused by virus, then antibiotics will not work for it. So it's very specific. It's meant for bacterial infections only.
All right. And of course, today's main topic is we're going to be talking about antibiotic resistance. This is a major concern as of over the past few years, because I think you would be the one who could tell us that. What is antibiotic resistance and what has caused this incident?
Okay, as I said earlier, antibiotic is used to treat infection caused by bacteria. So antibiotic resistance is when these antibiotics, when we use to treat the infection, then the bacteria become very strong, and therefore these antibiotics lose their ability to fight the infection. So it means that this bacteria, from a typical normal bacteria, it has developed and moved to become a superbug. So superbug means when we give any usual antibiotic, it will not work. So you may have to change the antibiotic, or some infection caused by superbug, we don't even have effective antibiotics. So there are many ways, many reasons why we get this antibiotic resistance. One of it is when we use antibiotics for infection which you don't need antibiotics. For example, if it's virus infection, you don't need antibiotics, but when we take antibiotics, so we expose ourselves unnecessarily to antibiotics, so it's a factor. And sometimes, doctors prescribe you medication for 5 days. You have to take 2 tablets 3 times a day. So you have to take it as prescribed. So if we do our own modification, we take for 2 days or 3 days, so the duration is not correct. The dose is inadequate. Over time, it also promotes resistance because the bacteria didn't die fully. Instead, it's like what I always say to everyone: what doesn't kill you makes you stronger. So that's what happens to the bacteria. So it becomes very strong.
Yes.
So apart from that, actually, we do realize that in pets and livestock, they also use antibiotics. So these livestock are fed with antibiotics for their, they want their livestock to last longer, not to die of disease and everything. So that already there, and we consume this livestock, so we get that too. So these are all the various reasons and factors how we get resistance.
And of course, this is becoming a problem. Why is it a problem, and what would the impact on society be?
Okay, so this antibiotic resistance has been a global threat. It's not just a worrying thing, it's a threat, and it's been there for long. And more and years to come, it's getting more and more, and it's affecting our healthcare system. It gives us a lot of challenge, because it gives us challenge to find an effective antibiotic to actually treat an infection. So more and more antibiotics are needed. So as let's say now we have whatever antibiotics we have in market all these years, so now they are all resistant. So we have bugs which are resistant to it. So now we have to wait for new antibiotics to come up.
Yes.
And as new antibiotics takes years to go into research and development, and for them to come up with the antibiotics, right? So in that process, a lot of antibiotics also get resistant. So this new antibiotic in the market only have few years of survival before it get resistance. So apart from that, in all the various, like we have various type of drugs which are producers, right? Medication which is manufactured. Antibiotics has the least number of new antibiotics. So it takes time and it's less. So that is the major issue. And when we don't have enough or good antibiotics to cover this, so it causes spread of resistance. So it kills a lot of people because we don't have an effective antibiotics to cure it. And if we do have some newer antibiotic which works, but those are very costly, very, very expensive. So it actually increases our healthcare costs. So it's not only kills, it causes future damage and also increases the cost.
Yes, economically as well as socially. And if I'm not mistaken, you can correct me if I'm wrong, there is only a finite number of antibiotics that we can make, right? It all has to come from somewhere, so there's only a certain amount or a certain type that we can make. So is it possible in the future that we will run out of antibiotics?
That's very possible. As I said earlier also, I think now as per WHO's record, I think there are about less than 50 antibiotics still in phase of clinical trial. That means those are new. But if they are in the clinical trial, not everyone will make it through the end. Some may not pass. That means it will be resistant halfway through the R&D process. So they will not come out to the market. And if they come out to the market also, they last very long before the bug become resistant to them. So we don't even have much time to use it. So it's going to go what we call in our field antibiotic pipeline. So how much is coming out antibiotic? So the pipeline is like getting smaller and smaller over the years. So now we are getting very few antibiotics.
Yep, and as you said, whatever we are getting also is getting to be quite expensive.
Yes.
All right, so this is a major problem because bacterial infections are major causes of multiple diseases on the planet, and also for, we still have third world countries which are heavily reliant on those. So the impact is quite high. So let's hope we don't hit that point anytime soon. Hopefully not in our generation or the next. But tell you what we're going to do, we're going to take a short break. We're going to listen to one song. And once we come back, we're going to be talking more about antibiotic resistance. By the way, if you do have any questions, you can send them to our TikTok page and we'll be more than happy to answer them. But let's keep it about antibiotics, yeah? No general, stuff. All right. Anyways, right now we're talking about antibiotics. Use wisely, stop resistance in conjunction with World Antimicrobial Awareness Week, 18 till the 24th of November 2024. In the studio today, we have Anitha Ramadas, who is a pharmacist with Kuala Lumpur General Hospital. We'll be right back. Welcome back to TRAXXfm. Today we're talking about antibiotics, using it wisely, stopping resistance. And with us today is our guest, Miss Anitha Ramadas, who's a pharmacist with the Kuala Lumpur GH General Hospital. Now, what exactly is the right way to obtain antibiotics, Anitha?
Okay, I think this is very important to know that antibiotics can be only prescribed by a registered physician. What I mean is a doctor. So you can't get it over the counter or get it anywhere else. So you need a valid prescription from a registered doctor who give you the prescription after doing all the assessment. So they think that you need the antibiotics, you have a bacterial infection, and you need the antibiotic, they prescribe. Then you can either obtain it from the clinic itself or the office of the physician itself, or you can go to any retail pharmacy and get it, but you need a prescription. So you shouldn't get it without a prescription or urge anyone over the counter, go to a pharmacist and try to push the pharmacist there to give you antibiotic because antibiotic is listed in the Poison Act, so we can't give it without, so that it's controlled.
No pharmacist, no self-respecting pharmacist is going to help you.
Yes.
Absolutely. It is a very, very tough place to work in, but so they're not going to help you if you just walk by like, hey, I want this antibiotic for something. And not going to happen, right?
Yeah. Now they are very strict, and I think everyone has the awareness that they shouldn't give, because it's not just for themselves, it's actually for the future as well. And it's not only about the legality of it, it's also the awareness that antibiotic cannot be misused. Nobody is like giving it out just like that nowadays.
Yep. Because if antibiotics do run out, even a normal cold can kill you. So that is scary. Ooh. Well, anyways, this question, I think you've already answered it. Can I stop taking antibiotics after a day of taking them, or reduce the number of pills taken after feeling well? Do you want to just add on something to that?
Of course, not at all. Have to be taken as prescribed, because I think a lot of people feel that after you've taken the antibiotics for a few days, even with 1 or 2 doses, you feel better. But that is because the antibiotic is working for you and the bacteria are all like dying. But for different infections, we have a preset of durations. So some it's 5 days, some can be even a year of antibiotics. It's depending on the type of infection, what bacteria causes it, and how severe it is. So it has to be taken according to the prescribed quantity and duration in order for it to, number 1, work. Number 2, don't get resistance. Number 2, don't fall sick again, because it can come back again. When it comes back, it's stronger. It may be super bug and it's difficult to treat. So just take it properly.
Yeah, just take it properly. Even if you forget, take it. Right? Yeah. Take it. Set a reminder and take it. Well, why is it said that fever, cough, flu do not necessarily require antibiotics?
Okay. So fever, cough, flu, these are generally caused by virus. Very rarely it's caused by bacteria. Those common cold and flu and all that is caused by virus. So when it's virus, antibiotic doesn't work, because antibiotics meant for bacterial infection. So these are not bacteria. So most virus infection, it's self-limiting. So in the sense that you get good rest, drink a lot of water, get some symptomatic treatment like fever, get paracetamol, and so on, then you'll improve. So you can rest. So don't have to take antibiotic if it's not bacterial origin.
Yeah.
All right. There are fever which is due to bacterial infection. So those assessment is to be done by the doctor. The doctor can assess you and then decide whether, okay, this is an infection caused by bacteria, so I need to give antibiotics. So then they give you antibiotics, then you take it accordingly. So don't pressure the doctor saying that, okay, I have flu, I have fever, I need antibiotics.
Yeah.
So, so not all.
What if the doctor tries to push antibiotics onto you?
Yeah, that's a good one. So there might be instances where this happens.
Might be, yeah.
Might be.
Might be. Air quotes. We are doing air quotes.
So if it happens, you as a patient, you always have the right to ask, right? So it's your right to ask, okay, am I getting an antibiotic? What antibiotic it is? Why are you giving me the antibiotic? So as a patient, you have to know what you're taking, why you're taking it, right? So you can't just take everything. So you can ask, you should ask. So then if the doctor tells you, oh, I think this is for flu, I just want to give you some extra antibiotics, then you can always ask, I thought all the flus are usually caused by virus. Do I need the antibiotic? You can question back the doctor. The doctor supposed to give you a valid explanation why they're giving you the antibiotics.
Absolutely. And I think awareness is key to that. So I think, and you have definitely answered, when are antibiotics needed? Only during a bacterial infection. That's the only time that you need antibiotics. All right, we're going to take another short break. We're going to be right back. Don't go anywhere. We're currently speaking about antibiotics. Use wisely, stop resistance with Anitha Ramadas, who is a pharmacist with the Kuala Lumpur GH. Hey there, welcome back. We are talking about antibiotics. Use wisely, stop resistance with Anitha Ramadas, a pharmacist from the Kuala Lumpur GH. And Anitha, what responsibilities do patients and society as a whole have in ensuring and maintaining the effectiveness of antibiotics?
Okay, there are a lot of things that we can do as a patient and society. So the easiest thing to be done is to get immunization. So there are, that means vaccination. So there are a lot of infections that can be prevented, or if you get it, it will not be severe if you were vaccinated appropriately. So everyone should get that vaccination. And then a good hygiene. It's not just personal hygiene, but also like food hygiene, the way we prepare the food, type of food that you take. So then you prevent from getting infection. These are preventive measures. So if you prevent infection, then you wouldn't need antibiotics.
Yeah, prevention
Right?
always better than cure.
Yes, correct. So we start with that. And then next, if unfortunately you do get infection, you do have fever and all the symptoms, go to a doctor. So follow what the doctor says. If they said this no need antibiotics, then don't pressure the doctor to take
Yeah, yeah, absolutely.
Yeah, there's a lot of time that even in the hospital or in the clinics, we always have patients like they are not happy if they don't get antibiotics. They feel that they don't get better. So this is news for all of you. Like, don't pressure. If they think it's needed, they will give.
Yes.
All right. And if they give you, do ask, like how we talked about earlier.
Yeah.
You have the right
Why?
to ask. Why? Why do I need the antibiotic? What infection do I have?
Absolutely.
And always remember, don't buy antibiotics online because now you can't get it in retail pharmacy. You try to buy online. So now online you can get anything under the sun.
Yeah.
So antibiotics is also there.
Yeah.
So don't do that.
Yeah.
Get properly through proper manner, proper channel, get antibiotics if you are needed. So that's like that is to prevent. Okay. So now if you do have infection, doctor gives you, please take it accordingly. So the tablets, number of tablets, how many times a day, as directed, and complete the entire course. So if we dispense the medication, right, antibiotics, we always have an extra label, complete the course. So finish it all. So is what we always tell everyone, even if you feel better over time. Then don't self-treat. And if you do have leftover antibiotics, by right you shouldn't have.
Yeah.
If you take it accordingly.
Yeah, don't.
Yeah.
You will never have extra
You
antibiotics.
shouldn't
at home.
have.
Yeah.
But if you happen to have,
Throw it away.
don't throw it in the dumpster.
Oh, don't throw it in the dumpster.
Don't
Okay.
flush it down the toilet. Don't do that. So you have to, all these antibiotic has to be, all medication in fact has to be like how to say, disposed accordingly. It cannot be disposed in a normal rubbish bin or a toilet bowl. So we have this program. It's called My MediSafe. Okay, MEDISAFE. MediSafe is actually a program to safe disposal of medication. So there are a lot of point of collection, selected pharmacy, and also even in hospitals. So they can Google it up in their website, find these places, and it's free. You can dispose through that.
So you send it back to that
Yeah,
location.
so
and
then we will dispose it in a correct manner that it doesn't go back to the environment. Because
Yeah.
when we throw in the dumpster or flush it down the toilet,
Leaching.
it goes to the environment.
Yeah.
And then from the environment, it goes back to us. It's like a cycle, environment to the animal to us. It goes in a cycle. So we do indirectly get acquired antibiotics without you knowing you are taking antibiotics to the food.
Yep, through leaching, the water cycle, everything, it works. And yeah, that is scary. I never thought about it that way, that it will definitely leach back out. And I guess with that, we are at the end of our interview for today. But before we end, do you have any take-home messages for our listeners?
Okay, so as we've been talking about, this week is actually World Antimicrobial Awareness Week. So this is celebrated every year. Our aim is to raise public awareness to use antibiotic rationally and responsibility. So because we want to control antibiotic resistance. So take home message again and again, not all infection needs antibiotics. If you're given, take it appropriately. Don't misuse the antibiotic. Antibiotic resistance is really happening. It's not a myth, it's a fact. And it's increasing and it's fatal. So we have to really take serious consideration into it. So whatever antibiotics we have to preserve it for our future generation. So please, let's work together to change and conserve the antibiotic. And I do think if anyone have any question, they can always reach out to us. Let me just read out. You can call the National Pharmacy Call Center, NPCC. So our hotline is 1-800-88-6722. So you can call during office hour, 8 to 5. If they got any queries regarding antibiotics. So we are always happy to answer and make you clear of anything. You can also follow our Kenali Ubah Anda Facebook, Insta and TikTok. So you can also post any question there. We are always happy to answer any queries.
All right. Okay, thank you so much, Anitha. We hope you have a good day, and thank you so much for sharing with us these very important points, especially about antibiotics and making sure that we don't get resistant to it, some of the ways that we can also avoid being resistant. And with that, I think our interview has come to an end, and we hope to have you again in the future.
Thank you.
All right, so that was Anitha Ramadas, pharmacist with the KLGH. Right now, it is time for more music to come your way. I'll be back in the next hour. Don't go anywhere. This is Traxx.